My presentation will cover some aspects related to the efficacy and toxicity of novel drugs, specifically some novel monoclonal antibody for the treatment of acute lymphoblastic leukemia patients in adults. And because we know that the prognosis and the overall clinical outcome of adult patient may be quite negative and worse, especially in elderly. And this is due to the fact that most of the patients respond to initial chemotherapy, but the proportion of patients relapsing after chemotherapy is quite high, and may be approximately 40 up to 50% of the patients. And the patient relapsing within 24 months after chemotherapy, or those who are refractory to initial chemotherapy, has a very poor prognosis. Due to this fact, recently some new novel drugs were introduced in the marketplace, specifically Inotuzumab, which is an anti-CD22 monoclonal antibody, and then Blinatumomab, which specifically bind CD90. These novel agents are quite efficient because up to 80% of the patients respond to these novel drugs. Those patients responding to these drugs may be treated with allogeneic transplantation. So I think that the use of this drug may be considered optimal when they are introduced as a bridge to transplant, so before transplant. For Inotuzumab, for example, the use of this drug may be performed in 2 cycles. So 2 cycles are the best treatment for a refractory or relapsed ALL. Now there are a lot of interest and a lot of publication, or at least a few publications and some clinical protocols looking at the clinical outcome of patients treated with sequential use or combination use of Blinatumomab and CD22 monoclonal antibody. But so far we have no answer about the optimal use of this combination of monoclonal antibody and for the treatment of ALL. So we are still discussing and which is the optimal use of this combination or of sequential use of monoclonal antibody. For that reason, at least 3 clinical trials are currently ongoing. And we do hope to have an answer about this in the near future. For sure, also CAR-T treatment may be an additional option for the treatment of relapsing remitting ALL, but the sequential use of CAR-T and novel monoclonal antibody is still under investigation. So in most of the cases, we use first and Inotuzumab, and then the allogeneic transplantation, and the CAR-T may be used for those patients who relapse after allotransplantation. But there is a lot of controversial point, and it could be very nice to discuss this during the SOCO meeting in Rome next week.